Welcome back to Rohrich Knows podcast, helping you become a better you and a more informed you. Well, what's one of the hottest topics today in all of medicine? It's regenerative medicine. Doing things with your own body or stimulating your natural body growth factors or everything to make it better and more youthful. So today we have a very special guest and a special podcast today to talk about that. A world expert in regenerative medicine, Dr. Sam Lynch. Welcome.
Dr. Rohrich, it's a pleasure to be here. I'm so excited to have this time with you.
Yeah, it's great. And he's here live with us in the studio. And he's amazing. He holds 2 doctoral degrees, one from Harvard. He's had multiple awards. It would take too much time to go through all of them. He's got multiple patents. But he is going to talk to us about some of the recombinant things that he's done, recombinant growth factors, and how he's bringing them to market, both not only on the reconstructive side, but also on the aesthetic side. So this will be, I think, a game changer, because in medicine today, in the area of aesthetic medicine, we have done a lot with fillers and neuromodulators, but now we are leapfrogging to really a new generation of biostimulatory agents that are natural. And that's what we're going to talk about today, Sam. So let's talk about growth factors. And obviously, you're a world expert. So how did you get started in growth factors?
I've been involved in this area of regenerative medicine before regenerative medicine was actually a buzzword.
Right.
So I did my original doctoral work a long time ago, PhD work looking at growth factors, and was fortunate enough to be in one of the labs that discovered some of the key growth factors, like the platelet-derived growth factor, the PDGF, and it was a very, very exciting time, right? We realized back then that there was some protein that signaled cell growth, but we really didn't know what it was until we isolated PDGF.
PDGF. Which is a real game changer in all of medicine.
Yeah, and fast forward a lot of years later, 2 or 3 decades later, and we have 4 FDA-approved products on what's called recombinant PDGF, which was an exact synthetic copy of the PDGF that we have in all of our bodies.
Right, and so tell us more about that. So, and you've formed several companies, obviously, that have used this, for reconstructive purposes, and now we're leapfrogging to aesthetic medicine. So what is recombinant PDGF?
Yeah, so let me maybe take a step back first, and then and sort of talk broadly about PDGF, and then I think that'll help us segue into recombinant PDGF. So, to me, platelet-derived growth factor (PDGF) is the most important growth factor in the human body. I mean, literally, we could not survive as a species without platelet-derived growth factor, because it is the growth factor that's delivered in our blood platelets immediately to a site of injury. It's just really incredible how this works.
Yeah.
It's the first line of defense. It's just a really potent growth promoting protein. So it promotes collagen and hyaluronic acid and wound healing and so forth. And it's the body protects it, if you will, and only delivers it to a site of injury in the platelets. So when we get a cut or an injury, whether it's cutting our fingers in the kitchen, or whether it's a broken bone in a trauma or accident, any place we have a blood clot that forms, what is that blood clot? It's platelets that have stuck together, aggregated, and fibrin and so forth, other things too. But the platelets, when they form the blood clot, they release the platelet-derived growth factor right at the site of injury, and it's what tells the body, hey, you're injured here, and we're going to bring in all these cells and stimulate this regenerative response. And so what we did in the laboratory was it took us actually several years to do this, but we were able to isolate the PDGF growth factor from platelets originally, and then get the amino acid sequence, right? All of our proteins made up of amino acids. So we were able to get the exact sequence of those amino acids that make up PDGF. And based on that, to find the gene in the human body that makes human PDGF, and then we're able to put the gene into yeast cells,
Wow.
and you can grow the yeast cells up like you're brewing beer,
Right.
and it has no other human component in it other than the recombinant PDGF,
Yeah.
and then you just purify it out of the beer broth.
Wow, that's amazing. And of course, it's biocompatible, it's very safe, and
Yep.
it's very reproducible, right?
That is really so. PDGF again, as the name kind of implies, it is the main growth factor in our PRP or the PRF, right?
Right.
The natural PDGF is. So what we have basically done, making it recombinant PDGF, is to take that most active growth factor that you have in PRP or PRF and produce it in large pharmaceutical manufacturing facilities
Okay.
under FDA guidelines, right? So that every lot is exactly the same.
Wow.
So we go through something like 10 different scientific tests on every lot of recombinant PDGF, pure PDGF, to make sure that it's pure,
Right.
that it's potent,
Right.
it's reproducible, stable, sterile, and just gives you exactly the same response every time. Whereas with PRP and PRF, as we know, it's somewhat variable depending on how it's prepared or the age of the patient, the health of the patient,
Right,
those
and
kinds
it's
of things.
very labor time intensive. And I just saw a patient today that had a tear trough deformity, and she really needed the recombinant PDGF. And now, of course, if you do PRP or PRF, you have to take blood and, spin it down and do all the things to get PDGF. But she was kind of pushed back on that. But I mentioned to her what we're going to talk about, saying, wow, if you can get it off the shelf, that's magical. And I think it's going to be a game changer in replacing, I think a lot of fillers were probably shouldn't have been used before, like the tear trough, for sure. And I think, and it's natural and it's reproducible, and the strength is the same uniformly. So that's very important.
And it's so easy to use, right?
Yeah.
Because it's off the shelf, right? So we make this and put it in a package so you can just literally store it on the shelf,
Yep.
right? But it's 1,000 or more times concentrated
Than normal,
than you can get from PRP or PRF. So it's more concentrated.
Wow.
It's right off the shelf. It's so quick and easy to use. There's no blood draw on the patient. There's no centrifuging. There's no risk of sterility contamination. It's just ready to go. It takes about 60 seconds to mix it up, and you're ready.
Yeah, I mean, that's amazing. And we'll show an example of a casing of that. And I used it last week in a complex revision rhinoplasty that had like 5 different rhinoplasties. And when I was done, I mixed it, and then I put it in that area. And hopefully all those PDGFs are working to help enhance wound healing. And it's amazing. And I think, that just sounds almost too good to be true. So what are the downsides of doing this and using this? And you're just launching it into the aesthetic market. Tell us a little bit more about that.
Yes. So I think another, in my mind, huge advantage, right? We both have, seen patients, taken care of patients, right? You still do it much more actively than I do, but because I'm now all into the science and everything.
Right.
But the first rule, right, is do no harm.
Right. Absolutely.
Right? So with pure PDGF, recombinant PDGF, you have the confidence of knowing that it has been approved through the FDA for 4 different medical therapeutic indications. When I say approved, that it's at the highest level of FDA approval.
Right.
So it's been through the phase 1 clinical trials, phase 2, phase 3 clinical trials, phase 4 post-marketing studies. It's been on the market now for some of these different indications and treated over 5 million patients have been treated with PDGF over many years. So you have that certainty
Right.
that this PDGF is safe.
Right.
That and what we provide, excuse me, in aesthetics, is exactly identical to the PDGF that's been through the FDA multiple times for orthopedic indications, so to heal orthopedic kind of injuries.
Okay.
For stimulating tissue regeneration in our mouth and dental indications, oral maxillofacial surgery
Right.
indications, and for treatment of chronic wounds like diabetic foot ulcers or bed
Right.
sores or that kind of thing. So it's really a tried and true technology and therapeutic treatment that's brand new to aesthetics.
Right. I know, and that gave me a lot of comfort.
Yeah.
When I read about it after I was introduced to you by you, and because the science is immense, it's fantastic. And you're right, to already have gone those highest levels of FDA approval and to have been used. You said 5 million.
5 million patients.
5 million patients. I mean, there's nothing.
You know, one of my most gratifying moments, I think, ever as a kind of a scientist and a medical regenerative medicine person, I was in one of these conferences that we both go to, right? And I had finished speaking and was walking out into the hallway, and somebody who had no idea who it was came up and said, "I got to tell you about this case." And I'm sure you've had this happen as well. And they started talking about our orthopedic product based on pure PDGF and how this patient had undergone a hip, a bone graft. They had taken bone from the hip, from the iliac crest, and had used it to transplant into a bone defect, and it had failed. And then now the patient had pain in her hip as well as still had the bone defect and had to be retreated. And the patient said to in this case, the orthopedic surgeon, "Isn't there anything else?" And he's like, "Well, there's this new product based on pure PDGF. It's the same growth factor that's in your body, but it's much higher concentration." So this patient said, "Yeah, I want that."
Yeah.
And they used it, and he said within like 6 weeks, it had already started to heal. And the patient went on and did beautifully, had no pain, there was no donor site, right? No blood draw. And so it makes a difference in people's lives.
Right. Well, I mean, yeah, I agree with you. And I think when you have such science and you apply it both to reconstructive and now aesthetic areas, I mean, and, not only is it, the science is great, the product is safe and it's potent and reproducible. I mean, I don't know of a true downside. I mean, I think that, and it's off the shelf. So I mean, that's the beauty of this. And that was why, I used it in the operating room, and it was very simple for my nurses to mix it up, and it's just beautiful. So, I mean, I think, so what's next? I mean, obviously you've just launched this in the aesthetic market. What do you envision its use? I mean, I can tell you, I think it'll be a game changer for replacing a lot of things where we used to use fillers in the tear troughs, and also enhancing skin texture, melasma treatment, all of these things which are really challenging to do. All of these complicated problem areas, we'd use recombinant PDGF.
Yeah. So right now it's on the market, and any provider can buy it.
So tell us about it. How do you get a hold of it, and what is its name? It's
if we could use a brand name.
100%. It's fine.
All right.
It's totally fine.
Because I'm a scientist and I like to adhere to those rules.
It's fine.
So it's called Ari Essence, ARI, and then the word essence. Pure PDGF plus. The plus stands because it comes packaged in together with sterile hyaluronic acid, a proprietary blend of HA. And it's on the market for post-procedure use topically, for example, after microneedling or laser treatments or that kind of thing. Just for aesthetic applications is what we have it, what we're marketing it for currently. But to your point, we would really, where I see the real benefits is not only in aesthetics, and it seems to work great there, and takes away the heat and the redness very quickly post some of those procedures. But, more the long-term benefits that you start to see in 2, 3, 4 weeks is really that collagen deposition, the type 1, type 3, 4, type 6 collagen production, natural HA production, so natural hyaluronic acid in our skin, and just better blood supply and oxygenation to the skin. So you get those nutrients to the skin better, and you remove the toxins better because you get a better blood supply to the skin. So that's all what I think is available to be used today. In the future, where do we hope to go? We mixing it with fillers, materials for skin boosting, or more deeper, filler materials, like mixing it maybe with Radius or some of those other type of materials.
Biostimulatory agents.
Yes.
Yeah, I mean, it makes sense because it really just kind of puts everything that it's mixed with into warp drive. I mean, but then, it really does. And I just see that as a huge benefit.
Well, one of the things, so we've talked about is stimulation of the dermal fibroblasts, of the angiogenesis, bringing the blood supply. But the other thing that it does is it brings in all those great stem cells.
Right.
So it's what we call chemotactic for stem cells, meaning it basically acts like a magnet to draw all those wonderful healing stem cells into your skin or wherever you place it. Could be in other indications as well.
Right. So tell us about, that's a good segue. Obviously, when you use stem cells with the FDA, you always go, oh my God,
and we're not adding stem cells. We're just stimulating the patient's own.
Exactly. That's right. So tell us how that differs from exosomes. Exosomes is also a hot topic today. So you've got recombinant PDGF, then you got exosomes, and exosomes are, again, are being used topically in skincare. So tell us about exosomes versus PDGF.
Yep. So two totally different things, totally apples and oranges. So exosomes, of course, are these extracellular vesicles that contain many different things. They may contain RNA or DNA or some proteins, and in fact, might have minuscule but some level of growth factors right in them. And they're derived more from natural sources. So they're naturally derived extracellular vesicles, whereas the pure PDGF, again, is an exact copy of the PDGF that's in our body, but produced in large scale under pharmaceutical conditions, just like any pharmaceutical drug would be produced. So as opposed to exosomes, which
have some,
but not very much, the pure PDGF is really pure, powerful, potent, and consistent because it has all these lot release tests. And I'm not sure, frankly, if exosomes have any lot release tests. It's a much newer.
Right, and it's very variable. There's a lot of companies out doing it. Some don't even tell you where it's derived from, and some do. And it's very. It's kind of a mixed bag. You have to be very careful because I think it's been touted as a messenger to encourage stem cell proliferation and everything, and I think it may do that, but it sounds like it's still not that well regulated.
That's a great point. So to my knowledge, there are no exosomes have ever received FDA approval for anything, let alone treatment of what we use them for in the skin. But specifically, certainly in the aesthetic area, or reconstructive area, I'm not aware of any FDA approvals on any exosomes. Whereas again, pure recombinant PDGF has been FDA approved 4 times. So again, it's just night and day in terms of the level of documentation, safety, the mechanism of action of pure PDGF is just so well understood and has been for years. It's just, again, it comes back to first do no harm, right?
Right.
why I put the patient at risk. And I'm not saying that, exosomes, all exosomes are bad. They're all different, right? As you said, that's very variable. So some may be okay, I don't know. But what I do know is that the pure PDGF is the most well-studied growth factor and the only growth factor to ever got FDA approval.
Yep. No, I think that's great. That's a very good clarifier. I mean, there are some reputable exosome companies, some that are in the U.S., the platelet-derived growth factor. I mean, platelet-derived exosomes, and and I think, and they're doing. I think they're doing the right things to do it scientifically and to hopefully get FDA approval for various different things, kind of much like what you've done with PDGF. But I think it's kind of a little further away than obviously what.
It's probably where we were 10 or 15 years ago, probably 15 years ago, trying to get those FDA approvals compared to where we are today. One other point, and this is just brand new data, literally just got it last week, just a few days ago. The other thing you have to be concerned about is how these exosomes are made, right? And again, what testing do they go through before they go out to your patient? One of the very simple things that we looked at, of course, are sterility and endotoxin level. And if you notice, again, I may be wrong. If I am, somebody will correct me, I'm sure. But most, if not all of these exosomes none of these exosomes are labeled sterile, right? Yeah. Pure PDGF is sterile, and it's labeled sterile as such, right? And so what we saw then was when you looked at endotoxin, endotoxin, of course, is a broad inflammatory agent. If we're exposed to it in our body, it can create all kinds of havoc and inflammation in our body. I'm not, again, won't use brand names here, but we tested 3 different very commonly used exosomes. All 3 had high levels of endotoxin. 2 of the 3 had 20 to 30 times the level of endotoxin that we would ever allow to be used in area essence and pure PDGF. So, okay, you know what? If they're topical onto intact skin, probably no problem. But the minute you start putting them on disrupted skin,
different story.
Different story.
Yeah, I agree. Wow. Incredibly wise words from a real expert in regenerative medicine, Dr. Sam Lynch. Thank you so much, and I cannot tell you how much I've learned in this short segment. So know before you go, be aware of all of the advantages of recombinant PDGF. It's going to be a game changer in all of aesthetic medicine, just like it's been in reconstructive surgery. So please, leave us your comments, give us your thoughts, and I'm sure we're going to have you back, Dr. Lynch, because this is just the beginning of a true crossroads in really changing how we look at aging and aesthetic medicine and way more than that. So until next time, helping you become a better and more informed you.